80% of hair transplants will fail if you don't follow this 20% rule. Do you hear what I said? 80%, that's a pretty high number, right? So you have to listen. If you're planning for a hair transplant, trying to make the decision for a hair transplant, you need to make sure you stay in this 20% that your hair transplant is going to be successful. Now, if you're coming across this video for the first time, my name is Dr. Echefu. I'm a hair transplant surgeon. I've helped thousands of people regain confidence through hair regrowth and hair transplant. So now, what am I talking about today? So 20% rule is that what you have to do to ensure the success of your hair transplant. I don't care where you're going to get a hair transplant, but you have to make sure you follow this 20%. I've seen a lot of my clients coming in for hair evaluation, wanting a hair transplant, but they are not compliant with taking their medication. They are not compliant with following instructions on what to do concerning hair loss. And sometimes people actually think a hair transplant is like, is a simple procedure. Let me tell you, it takes anywhere from 8 to 12 hours, sometimes 16 hours for a hair transplant, for a successful hair transplant. So I want you to understand that it's draining. So when you're trying to make a decision in going for a hair transplant, you have to factor in these 4 things that I'm about to tell you. So for you to stay in that 20% of people making sure that their hair transplant is going to work, you need to follow these instructions. So number 1, do you realize most times, in fact, all the time, medical treatment is indicated for hair loss. So before making a decision to go for a hair transplant, you have to make sure your medical treatment, then you have to be compliant with taking those medications. So it's not enough being prescribed medication for hair loss. You have to be compliant. You have to take those medications because without the medical treatment, your hair loss is going to be progressive. So you're actually going for a hair transplant, but remember, you still have your native hair, which is going to get progressively worse if you don't take your medication. So that is why medical treatment is important. So you have to understand, in coming for a hair evaluation, medical treatment is important. So not just taking your medications before the hair transplant. It's also important to continue your medication after the hair transplant. Before, during, and after the hair transplant. It's very important for you to continue your medical therapy. You don't just stop. You cannot stop your medical treatment because when you stop your medical treatment, you're actually missing one part of the treatment for hair loss. Remember, hair loss treatment can be medical, can be surgical. So if you're missing the part of medical treatment and just go for surgical treatment, you're actually doing yourself a disservice. So number 2, for you to make sure you stay in that 20%, making sure you have a successful hair transplant, you have to make sure you spend some time reading your pre-operative instructions and your post-operative instructions. Why do I say that? Now, in those pre-operative instructions, they're going to tell you what not to